Hello everyone. Today's my topic is the causality assessment. Today I am going to telling you what is the causality assessment. That means causality assessment means it shows the relationship between the any drug and any adverse event. Shows the causal relationship between any drugs and event. What are the objective of that causality assessment? Objective or purpose of that causality assessment is to evaluate risk and benefits, means to reduces the risk of the drug and improve the benefits of the drugs, and also to find out the causal relationship between the drugs and events, and also to find out to evaluate the signal detection, also evaluate the ADR reports in the early warning signals. These are the some purpose or some of the objective of this causality assessment. There are also some methods of the causality assessment. First one is the global introspection. Means in that method there is the assessing the causality. Means causality assessment assessed by based upon the clinical judgment, means which is assessed by the expertive panels, means which are the expert in that field of the adverse drug reaction. Second method of this causality assessment is the WHO UMC system, means WHO Causality system or UMC system. That is the in this system, which is the most important, and most company also use this method also, which is the very easy method also. And in this method causality assessment, which is the assessed by the globally, means world, which is the international monitoring of the drugs. It is also means this system which is for the international drug monitoring, and also this method having some this method is divided into 6 criteria according to their causality relationship between drug and event. These criteria are the means it shows the time relationship between the drugs and event, and also some absence of the medical history and disease, and some responses of the drug withdrawal, means drug means and then also some responses to drug re-challenges, means reintroduced to drug after the discontinue of the drugs. And these are the some 6 criteria of this WHO UMC system. And according to these 6 criteria, this system is assessed by the scales, and these scales are the certainly means confirm, means in that case there or means including these all these 4 criteria, and criteria to meet in the probable only A, B and C criteria, only 3 criteria are met, and in possible there are only 1 criteria is met, and in unlikely there is no criteria to met, means there is reaction is unknown. And some also unclassified and unassessed scales are also given, but these are not only 4 are important. These 4 certain, probable, possible and unlikely, these 4 are important. And then third method of this causality assessment is the Naranjal scale. It is the most important method, which is show the this method to assessing the causal relationship between the drug and event, means to assessing the causality assessment by this method, by giving the questionnaires which given this Naranjal scientist given the same 10 questionnaires, and which is having answer yes or no and some adding then adding that questions, and then shows the its result. If the question all questions are true, then all questions having additions like some 9, then there is a definite ADR, means 100% ADR is occurs due to the our drug. And also the then probable, means in between the drug means scale addition is occurs in between the 5 to 8 criteria. Then impossible, there is reactions occurs in the 1 to 4. And in the doubtful, means there is a zero scale, zero addition is occurs of that questionnaire, means there is the that shows the reaction, means adverse drug reaction is not occurs by our drug. These are the some methods of this causality assessment. And thank you.